Now to our health feature of the day, and from overwhelming fatigue to brain fog that makes it impossible to complete daily tasks, long COVID is having a devastating impact on people's lives around the world. As the world observes Long COVID Awareness Week, I spoke to Wachuka Gichohi. She contracted COVID-19 in 2020, and the symptoms have persisted since then. Tonight, she shares her experience of living with long COVID and the impact it has had on her physical and mental health, as well as her ability to work. Wachuka Gichohi takes us back to when she contracted COVID.
My journey started in March 2020. I think I might have been one of the first people in Kenya to contract COVID. I contracted the virus after a trip to the Netherlands. I was going to visit somebody, and somewhere on my trip or on the way back, I contracted it and started with a couple of symptoms, not all the typical ones. So I started with a sore throat, body aches and pains, migraines, fatigue, acid reflux, and chest pain. Immediately sort of was quite worried because, in the news already we were starting to hear about the virus. Not too much information was out there, so I immediately rushed to go and see my GP, who prescribed me with antibiotics. Actually, it ended up being 2 rounds of antibiotics. Went back home, rested for a couple of weeks. It was pretty tough, and then after a couple of weeks, I started feeling like it was starting to lift. I started feeling a little bit better.
More than 2 years later, she is still dealing with the aftermath of having COVID-19.
2 months later, I had a complete crash, and all the symptoms just started to hit me one by one. Went through a total of probably almost 100 different symptoms since 2020 up to now. And I think it was, at the time, nobody knew what long COVID was, so it was really sort of confusing, very, very scary, just the most bizarre and painful symptoms.
It was a difficult period for her, she says.
Obviously, the first thing I did was to reach out to my GP again. And unfortunately, it was really a very unpleasant experience because he couldn't understand why I was still unwell, and it ended up being a lot of gaslighting because he basically just told me that it was all in my head, and I must have been having a lot of personal issues and I should seek help from a therapist. Very traumatic.
Wachuka's story echoes that of other long haulers from the persistent symptoms.
A lot of neurological issues, so memory loss, trouble concentrating, hallucinations, a lot of issues with my stomach, severe burning sensations all over my body, issues with hearing, eyesight, hair loss. I had a lot of issues with that, depression, anxiety, hormonal imbalances, tinnitus. So I have this buzzing noise in my ear, and that's happened every single day for 3 years, which is very difficult to have that on a day-to-day basis. Migraines, coordination issues, post-exertional malaise. This is a really big one for people with long COVID, where any sort of exertion, whether it's mental or physical, and it can be as little as going on a walk for 5 minutes, it just sends you into a crash, which can last days or months.
To the struggle to have long COVID understood by doctors, family, and friends.
The initial illness, just like everybody who has had COVID, a certain number of days, then you test negative, and then from there you cannot pass it to anybody else. It is an invisible illness, so it doesn't necessarily show on the outside. So when I go places, people look at me and they say, "Oh, I thought that you were going through all of these things and all these symptoms, but you look fine from the outside." And unfortunately, that's what makes it very hard for people to believe us, is that they cannot see it from the outside. And I think people just assume that unless it's on the outside, then it can't be that bad. And that's very far from the truth. We've gotten very good at masking our symptoms and our pain when we have to go out in front of people.
She advises others to find supportive doctors.
I was referred to an integrative health doctor by my father, and she was great. She really listened to me. She's got a lot of experience with autoimmune illnesses and chronic illnesses. At the time, I don't know if it was even called long COVID, but she did say that this is sort of the after effects of COVID, and the research that's coming out is that it's a multi-organ, multi-system illness. It's not a respiratory illness like people initially imagined. I got several opinions from various doctors here and even outside Kenya that just with my condition and sort of what I'm struggling with and where my body is, it would not be a good idea to be vaccinated. My body would not be able to handle it and likely actually would make me worse.
She also started a Long COVID Kenya support group on Facebook to share her experience and learn from people experiencing similar symptoms.
We have about almost 200 members right now, and that's continuing to grow. Just the support, so people can also write on the group, I'm really low today, this is what's happening. I need prayers, I need encouragement.
I spoke to Wachuka's doctor about this condition.
So I would say the first thing is ascertain whether your symptoms are COVID or if it's a flu or if it's a cold. Figure out what it is, because if you know it is COVID, it doesn't matter how mild it is. People with mild infection can still develop long COVID weeks to months after they have recovered from their mild COVID. So to prevent long COVID, discover whether you actually have COVID and then follow your medical provider's advice on how to handle that COVID while you have it. It will reduce your chances of developing long COVID.
There is currently no proven medication for long COVID, but healthcare providers can provide care to reduce symptoms of long COVID.
At this rate, everybody is going to be affected by long COVID in one way, whether it's them getting long COVID or somebody that they love getting long COVID. And the only way to prevent it is not to get COVID in the first place. So mask up, be responsible, think about yourself and the people around you, and really just keep safe, because the pandemic is not over yet.
Okay.